I'm Dr. Jessica Fritz, and I wanted to show you a few percussive Tui Na techniques. These aren't usually techniques that you would begin body work with, but it is a nice way to move chi and blood and kind of wake your patient up after a treatment. So the first one we're going to show is called clapping. And so we're going to lightly cup our hands, our fingers are together. It has a couple of different translations. So that is cupping. We also can do chopping, and so this is just like the chopping movement that you're probably pretty familiar with. You can do that with a single hand. You can do it with your hands together. You can do it with both hands, and you just want the chopping to be rhythmic. You want to make sure not to do the chopping on any bony protuberances like the spinal process. Sometimes with the scapula, is a winging scapula. And you want to be gentle around the kidneys and just be cognizant of what's going on with the patient. If you get to an area that's really seems like it's tighter, you can stay there for a few minutes. If it's a smaller person, you can do a single hand chopping. And that's chopping. Another one that I really like is called knocking. And so here you can bring your fingers together so it's a little bit more pointed, and you'll again create a percussive technique. This is a really good technique if people have congestion or phlegm kind of stuck in the lungs where they're not able to purge it. A lot of times in that case, the patient will cough a little bit afterwards. You can also just focus on one particular area with knocking. Okay, another one is called pounding. And so pounding, you're going to put the thumb on the inside and have a loose fist. I'm going to do it really gently on this patient, but you can have different degrees of how you do it. So pounding, you can do it on the side of your hands, or you can do it prone. Or you can do it supine. Just depends on the area that you're treating and the patient. If there's a bony area that you want to do pounding on, you can cushion it with the opposite hand. And again, with pounding, you relax your shoulder and your arms. You're not using a lot of upper body strength. You're just naturally letting your hand fall. And those are just a few basic percussive techniques in Tui Na. Thank you.